Logan Together helped with the inception of the maternity hubs originally, and now provides support connecting partners and supporting those wonderful people that are creating the big change for mums through those maternity hubs.
If we were to do the things that women and their families were telling us they wanted to be done, which is bring a whole range of different experiences into a hub environment, and for that hub environment to be in a community setting, then that immediately required a whole range of partners to work together.
We have midwifery group practice, so midwives looking after women in a community location, co-located with wraparound services that support women and families into the first 1,000 days of life. We have 6 midwives in every hub. There are 4 community hubs, and we have an obstetrician that attends as well as part of the care that we give women in the community. So they come to the hub to receive their care, and we come to them, so they don't have to come into hospital.
So women can self-refer as well, so especially the women that we've cared for previously within the hubs, they usually call you quite early on in their pregnancy and want to self-refer in, so it's really up to the woman herself.
In our specific women, with the Indigenous women, they much prefer to stay far away from the hospital as possible. And coming to our space, we've got a culturally welcoming space. There's artwork on the wall, there's Indigenous staff in that space, there's Indigenous receptionists, and we've got a couple of Indigenous midwives. So it's just a culturally safe space where they can feel at home, and hopefully when they feel at home, they're more open to engaging with us and open to our suggestions of linking them into the community. Continuity of care by midwives has better outcomes for our women. Continuity of care models have known to reduce preterm births and different things like that. So that's just because they have a care of their own midwife, they have their midwife's phone number, and they can contact their midwife whenever they need.
Being able to be a part of the groundwork of it all, the establishing of the co-designing of the maternity hubs, and then to the point where families are now attending and they're accessing services, they're coming to the playgroups, they're coming to the antenatal appointments. Everything that we had envisioned is now coming out to play. The vision was to see our families, our Māori-Pacific Islander community and families and children flourish, to be able to have a space where they feel culturally safe, where they be able to come to this place, and then having that one-on-one, building trust with Village Connect and with each other.
I do like that it was available to me, because whatever I didn't feed back or feel comfortable to feed back to the medical professionals, I absolutely had that safe place to do that with the community connectors.
Access Community Services and Metro South Health designed this hub for migrant women who were having trouble with navigating the health system independently. The advantage with having access to a community maternity hub facility for clients has been the upskilling of midwives with their cultural responsiveness. Clients have said that previously when they have birthed through the general hospital system, they've found it sometimes their cultural preferences go unnoticed.
So here at the Browns Plains Early Years Centre, which is the Benevolent Society, we offer a range of services to the community. So we do have clients who are generally under 21. There's a lot of women in the Logan area who aren't accessing antenatal care, who are teen mums, and so having the hubs available to them, it's just easier to access. With a lot of our young mums, there is a bit of a stigma around, being a young parent, so we try to minimise that as much as possible to make them feel comfortable. We provide transport, we've got lots of different groups, the child health nurses, the midwives, and all of the other services are all here. We have the child and family practitioner team who provide family support, so that can look like one-on-one support in their homes, it could be a support at the hub, it could be out in the park, wherever our clients are feeling comfortable. Any mum is amazing, and the fact that they're young, it doesn't matter. So we're here to support them on their journey and make sure their little one thrives.
actually takes a new way of thinking, and the services have provided such new and expansive thinking in creating this new opportunity. So they've unshackled the barriers that have been holding them down, and they're creating a system of care which is extremely special. This is absolutely collective impact.